So next is anterior palpation technique for the shoulder girdle. So the anterior palpation, it could be divided in anteromedial or anterolateral. So let's start with anteromedial palpation. And basically in anteromedial section, basically we found the sternocleidomastoid, medial end of the clavicle, the sternoclavicular joint and clavicular head of the sternocleidomastoid. So again it is already marked. Basically sternocleidomastoid is used for localization. Here this is the soft tissue structure. In most of the cases the bony structure is used for localization, but here in next section it is a very important soft tissue structure which is used even for the cervical palpation as well as for the your shoulder palpation. It has its own importance for the localization. So first of all, as you can see that I have already marked. So first of all, just yes. Now it is just ask the patient to side bend and rotate the neck in opposite side. It is bulging out. It is getting prominent. So just follow the external head of the sternocleidomastoid and ultimately you will reach over the, just follow it like this. In the posterior side of your thumb pad or finger pad, you will feel the bony consistency. Here I can feel the some bony bulging sub bony structure which is prominent. So basically it is not your sternoclavicular joint. You have to position your thumb pad between the this medial end of the clavicle and this soft tissue structure means your sternocleidomastoid. In between these two structure, you have to place your thumb pad and the palpating pressure should be obliquely downward. It should be oblique. Okay. And now position your thumb pad. For the confirmation again, ask to the subject to elevate the shoulder and perform this elevation and depression of the shoulder joint. So you can feel or you can appreciate the movement between the manubrium and medial end of the clavicle. So basically the sternoclavicular joint is again found little bit more inferiorly from the medial end of the clavicle because some portion of superior portion of the clavicle not contribute in articulation with the manubrium. So this is the palpation of acromioclavicular joint and medial end of the clavicle. First you will identify the medial end of the clavicle and then further you can identify the sternoclavicular joint. Next, now most of the structure we have already discussed while palpation of cervical region. But again, you can revise it. If you follow this marking, basically it is representing the clavicle. If you are going from the medial to lateral side, ultimately you can feel another soft tissue structure that is the part of your sternocleidomastoid. Basically it is the clavicular head of your sternocleidomastoid. So you can also feel this tendon just distal to base, or if you move little bit more laterally, here again you can feel another muscle that is your anterior scalene. If you are not able to identify it, just ask the subject to deep breath or inhale. Just take, yes, relax. When patient is trying to inhale, this tendon is getting prominent. Again, there are other lots of the structure, but we have already done it in cervical palpation. So now come to the next, that is the anterolateral palpation of the shoulder joint. In anterolateral section, basically here some structure are again marked. It is the location of your coracoid process. This red area basically representing the tendon of subscapularis. The small rounded area is basically representing the lesser tubercle. So how to identify? Again, your palpation will start. If you want to identify this location, basically first of all you have to identify the acromioclavicular joint, and or you can also start from the hip or spine of the acromio. You can also observe this area is little bit depressed. Basically, it is found in every individual because it is the junction between your contour of, this is basically rounded shoulder is made up of by your deltoid, and this section is basically your muscle bulk of the pectoralis major. So this area is basically, which is called the subclavicular fossa. So it is remain little bit depressed. So first of all you have to identify the most prominent bump or acromioclavicular joint. From here you have to slide your finger pad or thumb pad inferiorly and obliquely towards the medial direction and try to identify a bony projection. Here I can feel that bony projection. It is basically, it is little bit medially marked. It is found here. So this bony projection, even I can feel the complete border, the medial border or medial margin of the coracoid. This is the lateral margin of the coracoid, and this is the location of the coracoid process. It has its own clinical importance because some very important muscles take the attachment from this section, like your short head of biceps. Next, if you want to identify the subscapularis, that is another tendon which is found just lateral to coracoid process. For this, you have to maintain the external rotation at the shoulder joint and then slide your thumb pad or finger pad laterally, and because this is the orientation of the tendon, so you have to perform this palpatory grip, and you can observe the movement of my finger. See, something is sliding underneath of my finger pad. See, so this is the location of basically your subscapular tendon, and this is the one of the tendon which is contribute in the formation of your rotator cuff. Next, for identification of next structure, that is your lesser tubercle. So here, if you move little bit more laterally and along with this, position your finger pad over here and perform internal rotation from neutral to internal rotation. You have to repeat this movement, apply little bit more pressure over this region, and you will feel that some very small rounded bony structure is striking underneath of my finger pad. The internal rotation, it should not more than about 10 to 15 degrees. So just repeat it again and again and just feel that bony eminence, that is of your lesser tubercle. Next is the tendon of supraspinatus. So basically this area or spine of acromion is taken as a reference point. First of all, you have to modify the limb position. Just ask the patient to position himself with extension, abduction and internal rotation of the shoulder joint, and place the hand, dorsum of the hand over the lower back region. So I have patient or subject is already positioned himself like that. Now identify the anterior tip. Just slide your finger pad little bit down, leave the arch and position your finger anterolateral aspect just below the anterior tip of the acromion or spine of acromion. Again you can observe, see the movement of my finger. It is sliding here, or I can feel the elastic consistency underneath of my finger pad. So I think all the structure I have covered from the medial to lateral side. First is your sternocleidomastoid tendon, second is medial end of the clavicle, then sternoclavicular joint, clavicular head of your sternocleidomastoid, anterior scalene, coracoid process. Next is tendon of subscapularis, lesser tubercle, greater tubercle, and the tendon of your supraspinal. That's all.